Hello everyone, I'm Anas Al Ubaidi, and the title or the topic for this session for this lecture is Advanced Overview of Ophthalmic Conditions and Procedures, and it is within Chapter 29 of Review of Neurology and Ophthalmology Scribing within the Certified Medical Administrative Assistant course program by ACMSO. I'm Anas Al Ubaidi with you, and let's start with this session. The introduction. An advanced overview of ophthalmic conditions and procedures is essential for medical scribes specializing in ophthalmology, um, the eye medicine, as it equips them with knowledge to support ophthalmologists in diagnosing and treating a wide spectrum of vision related issues. The field of ophthalmology is highly intricate, encompassing conditions that range from common refractive errors to complex diseases of the retina and optic nerve. Understanding these conditions, along with the procedures used to address them, is critical in ensuring high quality patient centered care. Medical scribes are vital members of the ophthalmic care team responsible for meticulously documenting patient encounters, test results, and procedural details. Accurate documentation not only aids in streamlining clinic operations but also safeguards patient safety by reducing the risk of errors. For instance, when dealing with glaucoma, the scribe must capture detailed notes on intraocular pressure for short IOP measurements, optic nerve evaluations, and personalized follow-up plans to ensure continuity of care. Similarly, documenting visual acuity tests, slit lamp examinations, and retinal imaging is key when managing conditions such as diabetic retinopathy or age-related macular degeneration, for short AMD. The diversity of ophthalmic conditions demands a tailored approach for each patient. For instance, cataracts, among the most common causes of vision loss, require thorough preoperative assessments and diligent postoperative follow-up. Retinal disorders, on the other hand, often necessitate advanced imaging techniques like optical coherence tomography, OCT. So, OCT is short for optical coherence tomography, and fluorescein angiography, which need to be detailed accurately for diagnosis and treatment planning. Other challenges or challenging conditions such as corneal ulcers or optic neuritis call for close collaboration between the ophthalmologist and medical scribe to ensure the effective relay of diagnostic criteria and therapeutic interventions. Procedures in ophthalmology are equally varied and technical, ranging from laser therapies like YAG or YAG, capsulotomy, and photocoagulation to advanced surgeries such as vitrectomy or corneal transplants. Each procedure involves unique documentation requirements, including pre-procedural consents, intraoperative findings, and postoperative care instructions. For treatments such as intravitreal injections for macular edema or anti-VEGF therapy for AMD, detailed note taking is crucial for monitoring patient progress and determining future treatment intervals. Now, the key points here: understanding common ophthalmic conditions, for instance, we'll start with the cataracts, very common. Overview: cataracts are a clouding of the natural lens, leading to impaired vision and often progressing gradually. Symptoms: blurry vision, glare sensitivity, and difficulty seeing at night. Documentation focused preoperative evaluation must include detailed visual acuity, slit lamp findings, and lens opacity grading. Now, postoperative notes should track surgical outcomes such as intraocular lens placement, IOL placement, and recovery progress. Example, patient presents with complaints of blurry vision in both eyes, worse at night, visual acuity measured at 20 over 60 OD and 20 over 50 OS, nuclear sclerosis observed on slit lamp examination. And this would be cataract. The diagnosis for such presentation would be um, cataract. And here is a summarizing diagram summarizing the comprehensive understanding of cataracts. Now, glaucoma, another common eye condition, overview here, a group of conditions leading to optic nerve damage, often associated with increased intraocular pressure, IOP. This is a leading cause of irreversible blindness, meaning the outcome could be, or the complication could be, if left untreated or left without management, with a risk of complication of a blindness, and it is irreversible, meaning cannot be fixed. That blindness that cannot be fixed anymore. Now, types: open angle glaucoma, angle closure glaucoma, and normal tension glaucoma. Documentation focus here: detailed tracking of IOP, intraocular pressure, optic nerve condition, for example, cupping, visual field testing, and treatment changes. Example, patient diagnosed with primary open-angle glaucoma, optic nerve cupping noted at zero point 0.8 in OS, with IOP reduced to 15 millimeter Hg after initiating timolol. And timolol is one of the drug of choice eye drops to treat glaucoma. A dry eye syndrome, keratoconjunctivitis sicca. Dry eye syndrome, keratoconjunctivitis sicca. Dry eye syndrome. So either you call it, both names are fine, keratoconjunctivitis sicca or dry eye syndrome. Now, overview: a condition caused by inadequate tear production or excessive tear evaporation, leading to ocular surface inflammation. Symptoms: burning, redness, scratchy sensation, and blurred vision. So documentation focus here: record of symptoms reported, results of Schirmer's test and slit lamp findings, for example, tear breakup time and corneal staining. Example, OD tear breakup time measured at 5 seconds, punctate epithelial erosions visible on a fluorescein staining. Patient advised to use preservative-free artificial tears every 2 hours. And here is a diagram summarizing the glaucoma overview. Complex retinal disorders. So here we'll go through some of the common retinal, also eye conditions or eye disorders, but more particularly related to retina. So diabetic retinopathy, overview: a complication of diabetes affecting the retinal blood vessels, leading to vision loss if left untreated. Divided into non-proliferative NPDR and proliferative PDR stages. Documentation focus: document findings from fundus examination, OCT scans, and fluorescein angiography, including exudates. Marker aneurysms or neovascularization include progress notes on anti-VEGF, VEGF injections or laser treatments. Example: fundus exam reveals retinal hemorrhages and cotton wool spots consistent with moderate NPDR. OCT demonstrates macular edema. Anti-VEGF or VEGF therapy-initiated OD. Macular degeneration. Overview here: age-related macular degeneration, AMD for short, age-related macular degeneration, commonly affects central vision. Dry AMD, age-related macular degeneration, involves drusen symptoms, deposits, and geographic atrophy. While wet AMD, we have dry and wet. The wet AMD, age-related macular degeneration, involves choroidal neovascularization. Documentation focus: dry AMD notes should include the presence of drusen and retinal pigment epithelium (RPE) changes, Wet AMD requires notes on subretinal fluid, hemorrhages detected on OCT, or injection treatments. Example, OCT confirms subretinal hemorrhages associated with wet AMD, initial ranibizumab, injection delivered OD. Diagnostic and imaging procedures. Visual acuity testing. Purpose here provides a baseline for vision and helps track changes over time. Documentation focus uses Snellen chart results, example 20 over 28 or 20 over 40. Record whether corrected or uncorrected vision was measured. Example, visual acuity 20 over 60, uncorrected OD improved to 20 over 25 with refraction. Optical coherence tomography, OCT. So OCT short for optical coherence tomography. Purpose here, a high resolution imaging tool to visualize retinal layers and macular structures, commonly used for conditions like diabetic retinopathy and AMD, the age-related macular degeneration. The OCT, ocular coherence, optical coherence tomography. OCT, optical coherence tomography. Documentation focus capture key findings such as macular thickness, subretinal fluid, or RPE detachment. Example, OCT reveal a significant intraretinal fluid accumulation in OD with macular thickness of 310 microns. Fundus photography. Purpose creates a detailed image of the retina to diagnose or monitor retinal and optic nerve conditions. Documentation focus include annotations about presence or absence of hemorrhages, neovascularization, or retinal detachment. Example, fundus image confirms retinal tear at 3 o'clock position with surrounding detachment in OS. Common ophthalmic procedures. Intravitreal injection, purpose used to deliver anti-VEGF, VEGF medication for AMD, age-related macular degeneration, diabetic macular edema, or vein occlusions. Documentation focus not eye treated, medication name and dosage, injection site sterilization, and post-injection patient condition. Example, intravitreal injection of bevacizumab administered OD following optical anesthesia. No adverse effects observed during procedure. Laser surgeries, type 1 laser trabeculoplasty for glaucoma. Uh, and here we have type 2 panretinal photocoagulation, PRP, for proliferative diabetic retinopathy. Documentation focus here record treated eye specific areas targeted, power settings used, patient response and follow-up instructions. Example, PRP performed OD, 300 burns applied to periphery with 400 MW power lasting 200 ms. Cataract surgery overview, removal of the eye's cloudy lens via vacoemulsification replaced with an artificial IOL. Documentation focus, record pre-op evals, IOL measurements, surgical notes, anesthesia type, and follow-up findings. Example, vacoemulsification OD, 25.5 diopter lens implanted, postoperative day 1, visual acuity improved to 20 over 40. Role of the medical scribe in ophthalmology. Pre-visit preparation. Organize previous patient records including OCTs, the ocular coherence tomographies, optical, the optical coherence tomographies, photos or last visit summaries for quick provider access, documentation during exams, accurately transcribe measurements, specific observations from slit lump exams or imaging outputs. Procedure documentation, capture all relevant details during injections, surgeries, or laser treatments, include constants and postoperative observations. Specialized notes, tailor notes per patient condition, including chronic progress monitoring and acute event capture or captures. Summary tables. Here we have a table on key symptoms and their documentation in ophthalmology. Symptom essential details to document, example, diagnostic importance, consequences of missed documentation. Symptoms, we have blurry vision, eye pain, redness, loss of vision, photophobia. Table on essential diagnostic tests and their standards. Test key elements to document. Example, clinical value, risks of poor documentation. Tests, we have visual acuity, VA, tonometry, OCT, optical coherence tomography, imaging, fundoscopy, fluorescence angiography. Table on handling complex ophthalmic conditions. Condition, key document components. Example, clinical importance, risks of poor documentation. Conditions, we have diabetic retinopathy, glaucoma, retinal detachment, corneal ulcer, AMD, wet form, wet AMD, wet and age-related macular degeneration. Table on common procedures and their documentation. Procedure, required documentation components. Example, clinical significance, effects of poor documentation. Procedures, we have intravitreal injection, cataract surgery, laser trabeculoplasty, corneal transplant, PRP laser therapy. Table on collaboration and multidisciplinary care. Scenario, teams involved and rules. Example, documentation focus, benefits of good coordination. Scenarios, diabetic eye management, post-cataract surgery, retinal procedures, pediatric ophthalmology, oncology, and ocular care. Then we will revise what we have covered through this lecture via some MCQs or multiple choice questions. Question 1. Which of the following is a critical symptom to document in a patient presenting with suspected angle closer glaucoma? A. Mild blurry vision without any pain. B. Sudden eye pain with headache, nausea, and vision loss. C. Gradual vision loss over weeks, particularly for close objects. D. Redness of the conjunctiva without increased intraocular pressure, IOP. Definitely the answer here would be B. Sudden eye pain with headache, nausea, and vision loss, as acute angle closure glaucoma is a medical emergency characterized by sudden onset severe eye pain, headache, nausea, and vision loss, often with elevated IOP. Proper documentation of these symptoms ensures rapid intervention and reduces the risk of permanent blindness. Question 2. When documenting OCT optical coherence tomography results for a diabetic patient with macular edema, which of the following is the most important to include? A. The patient's overall blood sugar levels and medication compliance. B. Evidence of retinal thickening and intraretinal fluid. C. The patient's visual acuity measured with correction. Or D. Optic nerve cap to disc ratio for glaucoma screening. The answer would be B. Evidence of retinal thickening and intraretinal fluid, as OCT imaging is crucial for documenting findings such as retinal thickening and intraretinal or subretinal fluid, which are indicative of macular edema. This supports diagnosis, treatment planning, and monitoring the effectiveness of anti-VEGF VEGF therapy. Question 3. A patient reports sudden flashes of light and a curtain-like shadow in their peripheral vision. What should the medical scribe prioritize while documenting this encounter? A. The patient's complete past medical history. B. Details about vision loss, location, and timeline of symptom development. C. Results of their most recent vision correction update. Or D. Findings from previous unrelated ophthalmic conditions. The answer would be B. Details about vision loss, location, and timeline of symptom development, as flashes of light and a curtain-like shadow are hallmark symptoms of retinal detachment. Accurate documentation of symptom onset, progression, and location is critical for ensuring rapid referral to a retinal specialist for surgical intervention. Question 4. Which test result is most relevant to document for diagnosing wet age-related macular degeneration, AMD? A. Elevated intraocular pressure, IOP, by tonometry. B. Subretinal or intraretinal fluid seen on OCT, optical coherence tomography. C. Shallow anterior chamber angles documented in slit lamp findings. Or D. Spotted neovascular vessels on gonioscopy? The answer would be B, subretinal or intraretinal fluid seen on OCT, as wet AMD is characterized by the presence of fluid or blood due to choroidal neovascularization. OCT imaging reveals subretinal or intraretinal fluid, making it a key diagnostic tool to guide treatment with anti-VEGF or anti-VEGF injections. Question 5. When documenting laser trabeculoplasty for a glaucoma patient, which detail is least important to include? A. Total number of laser shots applied and power settings used. B. The patient's last recorded visual acuity measurement. C. The eye treated anesthesia method and any immediate complications. Or D. Pre laser intraocular pressure IOP values. The answer is B. The patient's last recorded visual acuity measurement. As while visual acuity is important in general documentation, it is not directly relevant to the procedure of laser trabeculoplasty. The key details for this procedure include pre-laser IOP, treated eye, laser settings, and any complications during or after the procedure. And here we come to end of this lecture. Thank you very much and goodbye.